Hey everybody, Dr. Schultz at the Centeno Schultz Clinic. Today what we're going to be talking about is what in the world is a nerve hydrodissection and would it be appropriate for you or a loved one? So thank you for taking time. My goals here today are to explain what in the world a nerve hydrodissection is, identify the nerves that can actually be treated successfully with a hydrodissection, factors that may actually result in nerve compression. Describe what actual nerve pain feels like. It's terrible. And describe how a nerve hydrodissection is actually performed here at the Centeno Schultz Clinic. And most importantly, why in the world should you even care? So let's get started. Thank you. So what in the world is a nerve hydrodissection? It's a medical procedure. As you can see here to the right, it's done under ultrasound guidance. And its goal is to free up scar tissue or adhesions that are compressing or irritating a nerve, which can result in many different symptoms, including pain, numbness, and tingling. So which nerves can be treated? Great question. It's the peripheral nerves, the nerves that have already exited the brain and the spinal cord, as you can see here in this illustration. And here are some peripheral nerves that are going down the arm, and there are also nerves that go down in the lower extremities. So the peripheral nerves are the targets of nerve hydrodissection. And here are a couple of examples that may help you. Median nerve injury, otherwise known as carpal tunnel syndrome, a really painful condition at the level of the wrist where the median nerve is compressed. And that's depicted here. This is a cross section of the wrist, and you can see the bottom here is where the carpal bones are, and then the transverse ligaments on top. And all too often, they can result in compression, irritation, or actually damage to the actual carpal tunnel. And if you want to learn more information, so pain and numbness are the key, but if you want to learn more information, my partner, Dr. Pitts, did a great YouTube recently on carpal tunnel syndrome and PRP treatments. Another example of a peripheral nerve that's commonly treated with nerve hydrodissection is ulnar nerve, right here in the elbow. That's right there in the elbow, because the ulnar nerve comes around this bony surface. And this is known as cubital tunnel syndrome. And it's a painful condition where the ulnar nerve, as it comes across the elbow, gets compressed right in here. And the result is numbness, tingling in the hand, and most prevalently in the little finger and the ring finger. So what are the factors that can lead to nerve compression? Well, as you can see here, this was a terrible check that was actually got fouled. It was a very inappropriate move, but you guessed it. Sports injuries can cause nerve injury. Also, bone spurs. If a bone spur, particularly in the elbow where that ulnar nerve comes around, or in the wrist, if there's a bone spur, it can actually irritate or compress the median nerve. Tendinitis, inflammation of a tendon can result in irritation. Surgery, all too often, surgery results in scar tissue that in and of itself can damage, irritate, or compress a nerve. While the surgery may be actually successful, the side effect or the consequence of it is nerve compression. And then fractures, oftentimes, like these guys actually may have had a fracture of the bone. The healing process creates scar tissue, which can compress a nerve. So what in the world does nerve pain feel like? There are many different types of pain. Neuropathic, also known as nerve pain, typically arises from pain from a nerve that's being compressed or irritated or both, and it's dreadful. The common characteristics, it's a deep-seating, agonizing pain. It's poorly localized, and most importantly, it's fire-like, just like this. I mean, it's a deep, penetrating, really severe pain, and typically narcotics don't help it. You also can have pins and needles with this. So what in the world is a nerve hydrodissection? It's a minimally invasive procedure here at the Centennial Schultz Clinic. And with ultrasound guidance, what we look at before we even get started is we evaluate the nerve, and that's depicted right here. This is a normal diameter nerve here, and you can see here it actually gets quite thickened, so it's actually dilated. This is consistent with irritation and oftentimes pain and numbness. Also, what can happen is some of the constituents or the parts that make up the nerve, they also can be swollen, and that's depicted here. So before we ever get started, we're thoroughly evaluating the nerve to see if the nerve itself is actually swollen or are some of the parts within the nerve. And this is all easily visualized under ultrasound. This is, again, never done blindly. It should never be done. And so what in the world do we do? And this is the picture here of the procedure. So a small needle under ultrasound guidance, which is depicted here, a very, almost like a skin needle, a diabetic needle, is slowly advanced under ultrasound. And we park the needle immediately adjacent the targeted nerve. Do we try to get in the nerve? Absolutely not. We get right next to it, and that's possible. And then we inject specialized PRP through the needle in an effort to break up the scar tissue, relieve the compression, and increase the blood flow around the nerve so it can heal. And it's actually the injected PRP that opens up or breaks up the adhesions. So why in the world should you care? If untreated, peripheral nerve injuries can actually progress. And if left untreated, they can get permanent. You can have permanent nerve damage. You also can get progressive numbness and weakness. And if that goes on for a while, then what happens is the muscle starts getting smaller, otherwise known as atrophy. And then oftentimes the function of that extremity is compromised or limited. So it's much easier to treat the problem while it's small, to treat it with an ultrasound-guided nerve hydrodissection, easily done, not a very painful procedure. It's an outpatient procedure here at the Centennial Schultz Clinic. So please schedule an evaluation if you're one of those patients or have a loved one that is suffering from nerve pain that's regrettably just being medicated with toxic medicines. You can call our number here. You can go onto our website. You have lots of options. You can either do a telemedicine from the comfort of your home, your beach, your mountain chalet, or you can actually come into our office here in Broomfield or Lone Tree. And during that, you'll have a board-certified, fellowship-trained physician advise you on what's the best treatment for you. What non-surgical treatments can help you with this ongoing nerve pain. Finally, act today while the problem is small, because we all know if left untreated, things typically get worse. I hope this helped. If you enjoyed it, give us a thumbs up, subscribe to the channel, share this with a friend. Surgery and medication are not the only ways to treat peripheral nerve pain. Thanks so much for checking in.